So in this video we're going to focus on the desktop in Centricity, which is a good place to be because it shows you all of the information about things you need to deal with today, and it's usually the landing place when you first log on to Centricity, so it's where most of the important information is. And I'll show you on the left it has today's schedule, in the upper right it has any flags that have been sent to you, and in the lower right it shows you any documents that have been sent to you. And I'll go through each of these in a little bit more detail. So like I said, over here is today's schedule, and it really only shows you today's schedule. You can't scroll forward to look at tomorrow's schedule or look back at yesterday's. There are other places you can do that in Centricity, but not from the desktop. So if I didn't have any patients scheduled today, it would all look blank, kind of like here with these blue bars, but you can see I've put in a couple of imaginary patients here. And it's a nice place to be when you're seeing patients because all of the patients' names will be here and their charts are easy to access. So if I want to open Mrs. OBGYN test chart, I'll click on her to select her. You can see how it's red now, and I go up here to open chart, and that will open up her office visit. You can see here's her chart, but now I'm going to go back to the desktop. And I'll point out that most people reflexively would think that if you double-clicked on the name here, that would also open the chart. But in the default settings of Centricity, it doesn't open that. If I would click on cardio here chart, what it does is it opens up the appointment details, which isn't as useful amount of information. So actually you can change the default settings. If you want to have your preferences be that double clicking opens up the chart, you can adjust that in your preferences, and I'll show you how you do that. You go up here to Go in the upper left, and I'm going to go to Setup and then click on Preferences. And when the preferences window pulls up, you can see I can change my preferences for appointments, for how I view charts or handouts, but here I want to adjust my desktop preferences, so I'm going to expand that by clicking on the little plus. And if I look at the appointments window by clicking on that, that pulls up the details about how I view appointments. And so you can see here it says view today's appointments for FCC Anthony. That's my schedule. If I wanted to view somebody else's schedule, I could do that by pulling down this pull down window. But I'll leave it with myself. And down here it says double click opens, and right now it's set at appointment details, but I'm going to change it so it says patient chart. And so now when I go back to the desktop, if I were to double click on Ms. OBGYN test here, it would actually open up her chart now, and that's the way I'll leave it because that's the way I prefer it. And one last thing about the schedule is just that you can expand the scale or shrink the scale of the schedule by clicking here on this little thing over here above the calendar. So if you click on that, it expands it, so now each 15-minute slot looks bigger, but the default setting usually is to view it like this, and I think it's an easier way to see it. Now, in the upper right here are the flags, and flags are essentially like an internal source of email. It doesn't go out on the internet, so it's totally secure, and so you can see I have flags from a receptionist and a couple from doctors and a bunch from myself. So it's also one of the useful things to do with flags is to send yourself messages, and you can actually post-date them so that they appear on your desktop at a later date if you need to remind yourself something a few months in advance. So here's a new one that came to me today, and you can see I haven't opened it yet because it's bold here. And if I scroll over here, it says that Mrs. OBGYN tests needs a repeat chest CT. And I'll point out also that if I want to quickly glance at what the flags say, I can hold my mouse over the text of the message, and it brings up this little pop-up window that has the full text, even if it doesn't all fit on the screen to the right there. And above, I can do the usual things you can do with email. I can open the text, I could reply, I could forward it, I could remove it, and lastly, I could convert it into a document, which I'll discuss in another video. So down here in the lower right are the documents, and these are all just any type of documents. They could be lab results, they could be office visits that I haven't signed, they could be, again, messages from a nurse that the nurse is taking care of and then routed to me to look at. And you can scroll. Right now they're aligned in alphabetical order, which is not a very useful order actually. I prefer to have them sorted by date, so I can click here to have them sorted by date, but some people like to actually have them sorted by priority or by other types of things. Now, just quickly, I'll show you that on the left here, it shows you this little window that shows these pencils. And the pencil icon means that this is an unsigned note. So here's an office visit that has been started, but I haven't finished it. So it's somewhat of a priority that I get that one done. There's also priority messages. So you can see these exclamation points in this column show you different levels of priority. So red is an urgent message, yellow is a sort of intermediate or important message, and then standard is just without an exclamation point. And then to open any of these, I would just double click on it. So if I scroll down to Mrs. OBGYN test here, she has an open office visit. If I double click on it there, it's going to open up her chart like that. And so right now I'm going to go back to the desktop. So the last thing I want to point out about the desktop is that you can actually, this is the standard view of the desktop with all three things here, and it's called the summary, and you can see these tabs here that show you different views of the desktop. And so actually one of the useful ones is the documents view. If I would just want to view documents, I can click on this. And what this does is it shows me the same list of documents up here, but instead at the bottom now it shows me the text of each of the documents. So if I've selected on this one, it shows me the text of that. So it's a quick way of viewing a lot of, if I have a lot of documents to scan through, I can quickly see what it says, and I can decide if I just want to sign it or if I need to open it and address it or route it to somebody else by clicking on route here. So it's a quick way to look at your documents. You can do the same thing with your flags by clicking on the Flags tab, and you can change your preferences to have your desktop open to one of these tabs if you want, although I would suggest the most useful tab is to open up to the Summary tab. And that's pretty much all I have to show you about the desktop. It's fairly straightforward, and it's a good launching place to get into the rest of Centricity, which we'll discuss in other videos.